Okay, hi and Assalamualaikum warahmatullahi wabarakatuh to Madam Rohana Binti Maksum. My name is Nur Shahirah Binti Sabri. My metric number is 2020859532 from BA2353B. Okay, today I will share the topic about the challenge that facing healthcare industry. As we know, nowadays our healthcare industry face many challenges during COVID-19 pandemic, and it's become the big challenge for every frontliner in the healthcare sector. So I want to share and explain the challenge that facing healthcare industry. Okay, now let's begin. Okay, there are 5 challenges that facing the healthcare industry. The first one is the rising healthcare costs. The second is healthcare staffing shortage. The third one is the patient experience. Number 4 is the cybersecurity, and the last is number 5 is the price transparency. Okay, we come back to the first challenge. The first challenge facing the healthcare industry is the rising cost of healthcare. The reason for the high cost of healthcare is due to the increase in the production of medicine as well as the payment to insurance policies. The issue of healthcare costs has become a commonplace in the healthcare industry. In addition, the healthcare authorities have taken effective measures to curb the issue as well to help the patient reduce their treatment costs. In addition, all these measures are implemented to reduce the burden on patients. Among the initiatives implemented by providing the local price variation, preparing a value plans, and improving the insurance policies.
We're constantly trying to achieve balance in our everyday lives. That's why health insurance is important to ensure rising medical costs don't disrupt that balance. However, the rise in health insurance premiums has made some of us anxious. Let's see what's behind this rise. Over the years, administrative and operating costs of medical providers have been increasing. Together with new medicines and improved technology, they add up to the healthcare expenditure, which pushes the premiums up. Medical advancements not only give us better treatment with shorter recovery times, they also allow us to live.
Okay, now we move to the next point, which is staff shortage in the healthcare. This staff shortage is becoming one of the most challenging challenge in the healthcare industry. This is because, as we know, the country is being hit by the COVID-19 pandemic. Okay, the pandemic is difficult to deal because the number of people who have been affected is increasing, and every infected patient need a primary observation. As a result, the government has opened up many new job offers to replace the retiring nurses or doctors. In addition, the government also have included the use of technology in the healthcare industry in the term of the professional development and the resolution of the manpower shortage in the healthcare industry.
Dr. Harbash Sangha of Missouri's Lake Regional Health works 12 to 14 hours a day taking care of COVID-19 patients.
People are burning out. The burnout is very real.
Healthcare workers were already under stress pre-pandemic due to long work hours and low pay. Caring for so many COVID-19 patients for so long has pushed many to the brink.
Now we move to the third point, which is in the third point is in the term of patient own experience. This is because patients who are in the government or private hospital needs a good care of service. Therefore, most healthcare organizations are more vulnerable to competition due to the level of service provided. And as we know, government and private hospital provide a different service in the term of food preparation, bedding, treatment, and so on. Thus, the patient experience also become a big challenge and it's very difficult to face.
Hello, my name is Jim and I'm going to be your emergency room nurse today. What do you prefer to be called?
Susie.
All right, Susie. I understand that you're having abdominal pain today?
Yeah, it's been hurting since this morning. I've been throwing up all day and I can't keep anything down.
I'm sorry to hear that. Do you take any medications at home, including pain medications?
I, take 2 Lortabs every 4 to 6 hours for back pain, but it doesn't seem to be helping my stomach at all.
Okay, let me confirm this. So you take Lortabs 2 every 4 to 6 hours, as you need that for back pain, okay? I also see on here the physician has ordered a CAT scan and some lab work based on your symptoms. So somebody from the lab will be in to draw your blood, and I'll transport you over to take you to CAT scan.
Can I have some water?
Right now, based on your abdominal pain, and we need more information, so we don't want to eat or drink anything on the offside chance that you may have to have a procedure. If you were to eat or drink, it could delay your care. So I'm going to give you a call light. If you need anything at all, just be sure to hit your call light and we'll come in, okay?
Okay, in the fourth point is become the common issue in the healthcare industry, and I'm very sure that all of you maybe know about this challenge. It's the cybersecurity in the healthcare industry. For your information, the cybersecurity of the healthcare industry is now increasingly affected. In addition to the state of country hit by the COVID-19, there are many external threats such as theft of patient identities, disclosure of patient information, and digital applications such as telehealth. This telehealth is a major contributor to the cybersecurity. Therefore, various initiatives have been implemented to reduce the consequences of being hacked by the outsider, among others by implementing the multi-factor authentication and the strong firewall.
Cybersecurity isn't just something related to your PC or your laptop. In fact, nowadays, many devices are becoming more and more complex due to the increasing connectivity to computer networks and due to the convergence of technologies. Take, for example, medical devices. Many healthcare organizations have a lot of specialized hospital information systems and medical devices which are connected to the internet, to hospital networks and to mobile phones. So it is really important to make sure that all these devices and systems are cyber secure in order to protect people from potential harm and to protect data privacy. We can think of pacemakers. Well, people with an implanted heart device can be monitored remotely, and the information is typically sent via a home receiving unit that communicates with the hospital using an internet connection. An attacker could exploit the communication protocol to interact with the pacemaker. So it's clear that the software behind all these products can become really vulnerable to cyber threats, especially if the device is old, if the device is not updated, also if the device is not built with security and privacy by design principle from the foundation.
Okay, now we have entered into the last challenge that facing the healthcare industry, which is the price transparency. Is one of the main reasons consumers fail to settle their payment is because of the confusion in the price issue. The CMS has also issued a notice where from January 1, 2021, all hospitals must display a clearer price to facilitate dealing with the insurance companies or others. It also has been warned that any hospital or health center does not display their price can be dropped from the consideration. Therefore, this price transparency is the key in the healthcare industry to streamline all financial payment process.
Congress is debating the Price Transparency Act, which is really landmark legislation which allow patients to know how much healthcare costs before they show up in the doctor's office. 8 out of 10 Americans want to know the price before they go to see their doctor. If a patient were to go to an insurer, they could get a personalized estimate of how much things would cost so that they know if there are better deals in or even out of network for the first time. We don't want people not going to get the care that they need simply because they don't know how much it costs. Prices vary by where you park your car, the parking lot. So let me give you one example. Paula Bennett is in her early 50s and suffers from Crohn's disease. Her infusion therapies at the hospital cost $40,000 per treatment, which are every 8 weeks. She was paying a $30 copay for every visit. Even with generous insurance, the costs added up and the premiums increased the next year. Price transparency allowed her to switch the parking lot where she was parked and save $36,000 per treatment. That's the power of price transparency.
Okay, it seems like is the only part of my sharing today about the challenge that facing the healthcare industry. So I will end my presentation today, and I wish you all be in a good health, stay safe, and hope we can see in another day. Thank you. Assalamualaikum and bye bye.